Imagine stepping into the warm, inviting waters of your favorite vacation spot, only to find yourself at risk of a deadly, flesh-eating bacterial infection. This is the harsh reality for many travelers to popular destinations like Florida, where 8 deaths have been reported due to Vibrio vulnificus, a bacterium that can enter the body through open wounds. But here's where it gets alarming. The Florida Department of Health has confirmed 13 total cases across 11 counties, with last year's numbers being even higher, 82 cases and 19 deaths. And this is not just a Florida problem. Louisiana is also seeing a higher than average case count, with 17 infections and 4 deaths so far in 2025. The U.S. sees an average of 150 to 200 infections per year, according to the Centers for Disease Control and Prevention, CDC, with most cases occurring in the Gulf Coast states. So, what exactly is Vibrio vulnificus, and how can you protect yourself from this potentially deadly infection? Vibrio vulnificus is part of a wider group of Vibrio bacteria, which are found in coastal waters. This specific bacterium can enter open wounds when people are swimming, and warmer waters provide a ready incubator for its growth. Dr. Nathan Goodyear, an integrative medicine physician, explains that flesh-eating bacteria are thermophilic halophiles, readily populating in warm, salty, brackish water. Additionally, an increase in plankton blooms, which harbor Vibrio bacteria, is associated with increased cases. But what makes this bacterium so deadly? Vibrio vulnificus has the potential to cause severe infections, including invasive soft tissue infections and bloodstream infections. People who have skin infections often have high fevers and intense pain, swelling, and redness at the site of infection. And this is the part most people miss. Groups at highest risk include older adults and people who are immunocompromised or have chronic liver disease. Raw oysters and other shellfish can also be infected with Vibrio, leading to severe gastroenteritis or food poisoning. So what are the symptoms to watch for? Vibrio symptoms depend on the type of infection. People who have skin infections often have high fevers and intense pain, swelling, and redness at the site of infection, which usually occurs after an open wound is exposed to infected water. But here's the controversy. While healthy people generally experience only mild symptoms, those who are immunocompromised or have chronic liver disease can face serious health risks. In fact, about half of bloodstream infections are fatal. Some severe cases can cause an infection called necrotizing fasciitis, which is when the flesh around an open wound dies. This rare side effect has led to Vibrio vulnificus being described as a flesh-eating bacteria. But how is the infection diagnosed and treated? The bacterial infection is diagnosed by testing cultures obtained from stool, wounds, or blood. For mild infections, the CDC recommends increasing fluid intake to prevent dehydration. Those with severe or prolonged infections should receive antibiotics to improve survival rates. For people with infected wounds, surgery may be necessary to remove dead tissue. And this is where the debate begins. Antibiotics alone are not enough to calm the flesh-eating storm, according to Dr. Goodyear. Early surgical debridement to remove infection sources is readily required. So how can you prevent Vibrio infections? Experts recommend against swimming in open bodies of water like the ocean, rivers, and estuaries if you have any open wounds. To prevent Vibrio food poisoning, avoid eating raw shellfish, especially if you are immunocompromised or have chronic liver disease. If you do eat shellfish, make sure it has not been sitting out for a long time and comes from a hygienic source. While Vibrio infections are rare and should not be a major cause of alarm, it's essential to be aware of the risks and take necessary precautions. As Dr. Goodyear advises, for up-to-date information in your state and location, always check with your state and regional health departments for updates. Now, we want to hear from you. What do you think is the most effective way to prevent Vibrio infections? Share your thoughts in the comments below.